Hi, everyone. Welcome to another episode of Sisters and Scrubs. I'm Dr. Rebecca, your family doctor.
And I'm Dr. Vanessa, your pharmacist.
And today we're going to talk about a topic that we've been meaning to for a while. We're going to talk about peptides. And if you've been active on social media in the last year, you've definitely heard about peptides. So you've probably seen on social media a couple of peptides names, or you've heard of people taking these. So we're talking about BPC 157, TB 500, and CJC 1295.
So the timing of the episode felt right because a couple of weeks ago, Health Canada actually issued a public advisory warning people or suggesting people not to buy these peptides sold online.
So in today's episode, we're going to do three things. First, we're going to talk about what peptides are. Second, we're going to talk about the main ones. And third, we're going to talk about what's the best way in Canada if you want to take the path of actually getting into peptides.
So we want to say upfront, we're not here to tell you that peptides are not good or you shouldn't think about them. We're here simply to provide the scientific data that is currently available in regards to peptides.
So let's start with the basics. The word peptide gets thrown around a lot like it's something exotic. Peptides are just a short chain of amino acids that make up the proteins in our body. So our body makes thousands of peptides. For example, insulin is a peptide, growth hormone is a peptide. The GLP-1 drugs that we frequently talk about are peptides as well.
Peptides are not new. The pharmaceutical industry has actually been using them for over decades to develop peptide-based drugs, and they are well studied, and some of them work extraordinarily good. The issue is we're talking about the peptides that are sold online and that are labeled as for research use.
So this typically means that companies are finding loopholes in ways that they're able to sell products online by mentioning that it's only for research use, but it's available for everybody and anybody to purchase online and to inject themselves. So that's where it becomes a problem.
So in Canada, peptides are generally regulated as prescription drugs. So they have to be prescribed by a medical professional in a medical setting. So in Canada, authorized drugs contain a DIN number, so a drug identification number. So if you're buying these products and they do not contain a DIN number or they are not prescribed by a healthcare professional, then you know that these are not legal within the Health Canada system. So from the pharmacy perspective, I also want to add that if you are purchasing an unauthorized drug, you really truly don't know what's going on into the product. So Health Canada's advisory was also mentioning that some of these drugs that are sold online may also contain bacterial contamination, heavy metals, solvents, plastics. So we have to make sure that the source of which it's coming from, that it is clean. It may also not contain enough of the active ingredient that you're looking for, too much or too little. So there's really no regulations around it.
There's really no way to know what you're injecting yourself because it's not regulated. And we have seen this at the clinic. To be honest, we've seen patients come in and, admit to us that they've been taking these types of products. And unfortunately, as health professionals, this is not something that we can suggest or even follow because unfortunately, we don't know what's going into your body.
And another thing is it's not responsible on our part to give you recommendations about these products where there's no scientific data on humans that is proving that it is effective and also safe. So we don't want you to be the guinea pig. We have to make sure that we have the evidence to back it up.
All right, so the first one that we're going to talk about is called BPC 157, which is a synthetic peptide that is derived from gastric juice. The studies are mainly done on rats and mice, and the results are pretty impressive. So we do see faster repair of ligaments and tendons, gut healing, reduced inflammation, some neurological benefits. However, the problem is we have no human studies and especially no randomized control studies, which is like the gold standard of studies. So the problem with that is when people are starting to inject themselves, we have no idea. They're basically guinea pigs. We don't know what's going to happen in humans. We do see the results in rats and mice, but we don't know what it's going to do to each person individually and especially in humans. Another problem, other than what we mentioned before, is that compound also creates what we call angiogenesis. So it creates new blood vessels. And in people who have undiagnosed cancer, for example, it can increase the risk of tumor growth, which is pretty dangerous. And BPC 157 was one of the products that was named or listed in the Health Canada advisory as one of the products to be careful of. So be mindful before using this.
So the second peptide we're going to talk about is TB500, also known as the recovery peptide. So TB500 is essentially a synthetic protein that your body already naturally makes. It is known to be involved with reduced inflammation, help with recovery, with cell migration. So athletes really love this peptide, and studies that are done on animals are actually very interesting. They do show a reduced inflammation and tissue repair. However, the concern, again, as we said, is the lack of human data. The data that we have is only on animals. And just like the BB 157, there is also concern of angiogenesis. So, again, growth of new blood vessels. And for people who do have undiagnosed cancer or active cancer, this could be very dangerous.
So the next peptide we're going to talk about is an interesting one. It's called GHKCU, which is the copper peptide. This is actually interesting because it is a peptide that we do naturally create in our body, but it declines with age. So this helps with collagen synthesis, it helps with wound healing, it has antioxidant properties. And what's interesting is that we do have human studies on this peptide, but when it's used topically as a cream. However, we don't have studies for the injectable one. And some studies show, and especially in the Advisory of Health Canada, shows that there might be a lot of contaminants with heavy metals with the injectables. So be mindful that you can use this product topically, like as a cream, but for injectables, for right now, we don't have any randomized controlled trials on humans.
So now this is important to understand. We're not telling you that, peptides are bad, that peptides are no good. We do think that there will be a future for peptides in medicine. We know that clearly the GLP-1 drugs, which are peptides such as Ozempic, Wegovy, Zepbound, Mounjaro, they are changing medicine truly. However, it's really the delivery of these peptides that are being sold online, especially the unauthorized injectable drugs. So just be mindful of it because there's no monitoring from a physician. There's no quality control. We don't know what is the source. We don't know how much active ingredient we're actually getting. So it's mainly the delivery that is an issue. And until we have more scientific data on humans, we cannot safely advise to take these types of drugs.
And we do see this online. And I fell upon a page of a professional, if you will, of someone that was talking about or recommending peptides to take and for what reason. And this person was able to get these products online or when they were in the States. This is a person who lives in Canada. And they have a pretty big following. So they were recommending their followers to take these different types of peptides depending of what they were trying to treat, like for anti-aging, for collagen, for this and that. And they were also giving recommendations on, okay, so if you're taking this peptide, make sure to test this in your blood test. But this is so wrong in my mind to suggest your followers because your followers trust you so much and they believe in what you're saying that they will actually go and buy these products online and give it a try without knowing the risks or what they're getting themselves into. So when you're injecting yourself with something, be mindful of, okay, where's it coming from? Do I know exactly who's prescribing it? Am I going to have a medical follow-up? Is it coming from a pharmacy? Health Canada has these regulations for a reason, and it is going to be available in Canada one day. Like drugs such as retatrutide, which is like the next step of this weight loss drug coming to Canada, actually just went through the phase 3 and had really great results for weight loss. And it is awaiting FDA approval. So I think they will have that in the next couple of,
I
hopefully.
think early 2027 or something like
Yeah.
that in the States.
In the States. And then we usually get it here in Canada after a year or so. So we know that these are coming and there's a whole bunch of them being studied at the moment, which is going to be super interesting. But as of right now, if you don't have a medical professional prescribing this or giving it to you, just be careful of where you're getting your products. Just be patient.
And another thing is just because it feels natural doesn't always mean that it's safe. There are some consequences. You are still injecting a drug to your body. And another thing also, going back to what she said, is for me, a red flag is giving medical advice on social media because each person is different. Each person's medical history is different. Each person's situation or condition is different. And there's no way to truly know unless you're getting an individualized adjustment or treatment, or if you're getting a personal consultation with a medical professional. So just be mindful because social media sometimes can, create trends. And we, like, right now we're in the peptide trend, which, like we said, we're not saying that peptides are not good. We are seeing positive results, but on animals, which is not always repeatable with humans. So we need to wait for the data, make sure that it's safe long term, and also make sure that it's going to be something that's going to work for most people.
Exactly. So thank you so much for listening and stay tuned for our next episode. Have a good day.